Hello, good afternoon, everyone. And thank you for having me. I'm Dr. Bernard. As Dr. Campbell just said, I'm a consultant psychiatrist. I've worked in HSA for quite a few years, and so I have no conflict of interest, except that I work at the best hospital possible. And today, I'm here to talk to you about women's reproductive health. But first, I want to ask some questions, and if you can recall what they are, at the end of the presentation, I think you'll have your answers, but I'm doing just a test question, and I was warned that I have 20 minutes with too many slides, so I'm going to try to be quick, okay? All right, so some myth busters. Pregnancy is blissful, and women do not develop mental health concerns. Is that true or false? False. All right. Adolescents just go through phases, and they do not become depressed at all. It's just all their attitude. Is that true or false? False. Social support is a key factor in maintaining good mental health for women. True or false? All right, it sounds like everybody's awake and lunch wasn't too heavy, so let's start. All right, so let's see, okay. So the objectives of this presentation is to define women's mental health, to explore some of the anatomy, the physiology, and some of the psychological and social issues that may contribute to women's mental health. We're also aiming to explore some of the common mental health conditions over the lifespan of women, and to briefly discuss treatment, screening, and management. I'm aware that I have a mixed audience, so I won't go too much into the types of medication, etc., that we use, right? I'll just mention some of them. So we'll do some definitions, and the first thing I want to discuss is, what is women's mental health? Women's mental health can be viewed as the psychological and emotional well-being of women that results in them achieving full functional and other capacities. It's influenced by several factors, such as biological, social, and cultural factors. And as Dr. Charles just told you, the hormonal influences are significant across the lifespan of a woman. Some mental health conditions are more prevalent in women, for example, depression, post-traumatic stress disorder, and eating disorders. Factors such as hormone, trauma, intimate partner violence, role expectation, reproductive health can all affect women's mental health. So, just a definition, and I think Dr. also did that. When we talk about sex, for the purpose of this presentation, it has to do with the classification of male or female, and it's based on reproductive organs and chromosomes. So XX chromosome for females, XY chromosome for males for this presentation particularly. And this definition is actually from the Institute of Medicine. When we talk about gender, however, gender refers to the person's representation of self, whether or not it's male or female, and how the person is responded to by societal institutions or the person's individual gender presentation. So it's a bit different. So I'll use primarily the word sex or woman or girls, right? So some of the common differences in mental health conditions by gender and sex. This is a rapidly emerging and interesting area in psychiatry. Actually, this was what I did for my thesis. I looked at antenatal depression, and the discovery was alarming, especially that many women weren't being screened and many women weren't being identified during pregnancy. And I'm going to tell you why that is important. There are sex and gender differences in mental disorders. Differences exist in the prevalence of some disorders. As I just said before, depression is more common in females. Symptom course is different because symptoms tend to be influenced significantly by hormones. Risk factors are different. For example, women are a lot more exposed to intimate partner violence, etc. And as I go through the presentation, we'll discuss some of that. Cultural expectations such as roles, responsibilities, societal norms, and expectations are also different for women. So some of the specific factors. We mentioned that biology significantly affects a woman's mental health. Some of the determinants of health are not just based on the physiology, cannot just be hormone, but it's going to look at some of the social, cultural experiences of a woman, and also some of the physiological experiences and some of the psychological experiences and the environmental factors. Women will have varying experiences in comparison to men, and that will shape their mental health journey as well. What influences a woman's mental health? There are various theories surrounding hormone. Doctor went through that thoroughly. Estrogen and progesterone are implicated, but that cannot be the sole factor. A woman lives in an environment and has various experiences, as I said before. Changes in hormones will impact mood, memory, cognitive, and other functions, such as emotional regulation and reasoning. In women, some of these changes are cyclical and can cause significant functional and symptom burdens, and especially the functional impairment is a significant part of a woman's experience, especially around the time of her period. Or menses, whichever word we prefer. And I see some women nodding because I think many women in this room would have experienced some of those symptoms. So we'll discuss this some more. Some other social factors, as mentioned before, are family and psychological support. I mentioned cultural expectation and socioeconomic conditions. That's a major thing that affects a woman's mental health. Some of the researchers have found that women are likely to be in lower paid jobs. They're likely to be more to have partners that they rely on for certain financial and other supports. I was told that I have 10 minutes, so let's get going. All right. So, and I mentioned intimate partner violence before, that 1 in 3 women experience significant violence, and that contributes to their mental health. Let me get to the meat of the matter, though, and Mrs. Yearwood is there showing me her sign. So, mental health conditions that affect women across their lifespan. Mood disorders are more common in that depression is twice as much as in women. Anxiety is also twice as much in women. They have various theories that the estrogen and progesterone levels don't directly affect mood, but they trigger other hormones such as serotonin, GABA, and a lot of the other hormones in the body that control mood. In terms of the adolescent period, World Health said 1 in 7 adolescents will experience a mental health disorder. What we realize with adolescent girls, they're more likely to have depression, eating disorders, and they're more likely to have other psychosocial stressors like trying to fit in, trying to just go through that transitional period. And that can become very difficult for an adolescent female, right? So they're more likely to have depression, anxiety, eating disorder. And a note of suicidal risk. Suicide is increasing in general in our adolescent population. More so, girls will attempt more frequently, but boys tend to be more successful. Some disorders, as I mentioned before, were eating disorders and depression. So in the premenstrual period, or just before a female has a bleed, a week or so before, women tend to go through mood changes because their estrogen and progesterone is now triggering all of those other fancy hormones. And they go through a cyclical period of mood changes that can be anywhere from sadness, depression, lethargy, bloatedness, feeling unwell, just not feeling like you can get through your day. But it becomes very, very significant in about 5 to 8% of women who then have moderate to severe symptoms that are significantly debilitating. So we're going to just briefly explore premenstrual symptom, and then we look at premenstrual dysphoric disorder. So this is just showing what doctor had discussed about the hormonal changes, and it tends to be that week before your period in the luteal phase that you have the significant mood changes. So as mentioned before, some of the symptoms include anxiety, depression, crying, not sure what you're crying about, kind of sort of thing. I don't know how many women have experienced that. And then some of the physical symptoms, the weight gain, the bloatedness, etc. And the management of premenstrual symptom is symptom relief, lifestyle changes, talking to a counselor if you need, and screening for further mood disorders. Premenstrual dysphoric disorder, however, is very different because it significantly affects function, and it significantly affects family life, it significantly affects interpersonal relationships. And in the interest of time, what it is, it's that it's typically depression and anxiety, moderate to severe symptoms during that 1 week period before a menstrual flow. What happens is that women feel like they're not interested in anything, they're feeling sad, some persons may even have suicidal ideations, they're not sleeping well, they become overwhelmed easily. This happens in at least 2 cycles, and these symptoms are particularly debilitating. So, doctor went through most of these where it's the sex-related hormones that are significantly sort of there, just influencing the other hormones and the other systems in the body. Serotonin is a major hormone that's influenced by estrogen and progesterone, and I'm getting my 5-minute mark. I'm going to ask Mrs. Yerod to go further down in the crowd. But in essence, estrogen and progesterone are like the ones that are teasing the brain and causing that response in some of the hormones that control depression. And so the management is multidisciplinary. It includes early screening, and every physician, every nurse should at least ask women how they're coping in their periods. Ask women, how is your family coping? Because the irritability is also affecting partners, work, etc. How are you concentrating? So these are just standard screening tools. Again, the management is multidisciplinary with pharmacological agents and non-pharmacological interventions such as exercise, dietary modification, and tracking the menstrual cycle and the mood is going to also be important. For the medical persons, these slides can be available. Serotonin reuptake inhibitors are useful, and some hormone therapies may be useful for this as well. So the perinatal mental health conditions, and I'll just go through them quickly, includes antenatal depression, depression across the pregnancy, both antenatal and postnatal, anxiety disorder, bipolar disorder, psychosis, and a myriad of other disorders that can be worsened during pregnancy. So it's not all bliss. It's a lot of hormonal changes, physical and other socioeconomic factors that contributes to a woman's mental health during the perinatal period. Perinatal depression affects 1 in 7 women, and it's, as I said, it's a combination of environmental and hormonal changes. It's often undiagnosed, and I think I started the presentation with that. Mothers believe that this should be a blissful period, and so they think I always need to be smiling, I don't need to talk to persons or I will be judged, and so they don't report symptoms. What happens when a mother is depressed during pregnancy? She's also likely to be depressed after pregnancy. Postnatal depression increases the risk of maternal suicide, which is one of the leading causes of death in the late phase of pregnancy or post-delivery. It also affects the bonding with the child, predisposes the child to developing mental health concerns themselves. It also affects family relationships and the roles that mothers play. Society prides mothers on being perfect and being able to do everything properly, and a mother going through postpartum depression just does not feel like that. General management, again, includes pharmacological intervention and non-pharmacological interventions. SSRIs, or antidepressants, are indicated if a mother has significant depression during and after delivery. And medications have been approved by FDA that can be given if a mother is significantly depressed. Other non-pharmacological interventions include psychotherapy, ECT, social interventions. These are all proven to be effective if a mother has perinatal depression. I will now transition to menopause. And as Dr. presented, menopause is essentially the end of that reproductive cycle. And most of the women going through menopause, people just say, oh, it's a hot flash, oh, it's this, oh, it's that. But women can actually become very depressed and very anxious. They can actually develop psychotic disorders and other disorders just because of the hormonal changes. And at that time of menopause, many women are now having children who are leaving the household, so they're alone, there's stagnation, there's fear of what's next. So it's a critical period in a woman's life, and women, again, will need to be screened. And it's important to ask the questions, how are you doing? How are you managing? And to refer to specialist services for all of these conditions if you need to. And again, I've broken down management in non-pharmacological, which is family-based psychotherapy, and medication management. So, women's mental health, an integrated approach. It must be a multidisciplinary and a collaborative effort to ensure that women maintain well during their lifespan. There must be education, health promotion, and women should be empowered to be able to live normal lives and to reach the expected and desired outcomes of their lives. Services needs to be accessible, and we, as a community, will need to enhance psychosocial support and to talk about our experiences. I had a mother who was so ashamed to say, it's difficult to be looking after my baby, to be getting up at night. But then when you talk to that mother, she now realizes that, okay, every mother at some point feels this way, you're overly tired, right? Screening, as I can't emphasize that it's important to screen and to talk to women about how they're doing. If they come to the GP office, talk to them, nurses, talk to these women. We need to talk to people to find out what's happening and to extend ourselves and give that type of support. And I see the time is up, and I'm finished, right? So, mental health services offered at HSA, and sorry, I have to put up this slide. We have inpatient and outpatient services. And these are some of the resources. And for the physician and nurses, we have the MHGAP app, which is very helpful and it helps you to screen and see management, etc. It's a simple app that you can download on your phone to have some guidance on how to manage some of these common mental health disorders. And then I have put a resource from WHO, which is also helpful. Thank you. Thanks, Mrs. Lord. Thank you.